Hello, everybody, and welcome to this episode of Talk To Me Sis. It's going to be a solo host episode today. We're going to be missing Lise. She is busy with travel plans, so hate that she's not here, but I am not hating that we're having the episode because I am so very excited to interview our guest today. We have another Nikki in the house, so this is a double Nikki session. This is Nikki Tomczak from Texas, and her daughter, Olivia. I found Nikki quite by accident, but very happily on TikTok. Over this past year, I started seeing her videos and quickly realized that she was a fellow mom in the autism community and was just super intrigued with her take on parenting in the autism realm and the way she handles things and the way she approaches things. And then after I was watching her videos for a while, I realized that Nikki is a heart attack survivor at a very young age. And I know she's going to get into all of that and tell us more about that experience in her life. And we want to hear all the details and her journey as an autism mom with her precious daughter, Olivia, who is sitting there with her. Nikki has 3 children. They live in Texas. Her husband's name is Marty. On TikTok, they have an account together, which is not only extremely informative, but also hilarious. So if you're looking for some really good information and some really, really good thoughts and teaching, that's great. But you're also going to get a lot of good laughs if you follow Marty and Nikki on TikTok. So that's my little shout out to their social platform. But I am so excited to hear Olivia's story and what they have been through and what they have done to help her get to where she very successfully is today. So, Olivia, we are so glad that you hopped on with your mom. You look so pretty in your pink. I love it.
I love pink.
It's my favorite color too. Olivia, how old are you, sweetie?
I'm 22 years old.
You are 22. Now, did you just had a birthday, right? Did you?
I'm going to have a birthday this weekend.
Oh, it's coming up. Okay. I thought I'd heard that there was a very recent birthday. That is amazing. What are you going to do for your birthday?
I'm going to turn 23 this year.
And what are you going to do for your birthday?
Have a birthday pool party.
A pool party.
A pool party. That sounds amazing. I'm so jealous. I've not gotten to do much pool time yet this summer. That's going to be fun. And Olivia, tell me, where do you guys live? What state?
Texas.
In Texas. So you're hot, just like we are in South Carolina, right?
Mm-hmm.
Very good. Very good. Well, we are so glad to have you here and we are so proud of everything you're doing. I loved the video watching you get your first paycheck and watching you go spend your first paycheck. That is quite an accomplishment. And we are all proud of you and you should be so proud of yourself. So we are excited that you're here and super excited to hear from your mom. Okay.
Yeah.
All right. Okay. So, Nikki, let's just dive right in and get started. I'm pretty much just going to hand it to you today, but a couple things I want to say to the listeners and the viewers, to the people that are on YouTube. What most impacted me about Nikki's platform when I started listening to her was the directness and the assuredness with which she speaks. She caught my attention right away. I was like, this lady has done her research. She has walked the walk. She is now talking the talk and she has receipts that what she's done is successful. And you have a amazing way of presenting yourself. You are calm, you're clear, you're concise. I love listening to you. I think we all have so much to learn. And you have a very different story and a very different journey than a lot of people that we've talked to. So I think it's going to be really, really interesting for our listeners to hear from you and what you have faced and what you have found in bringing up a child who started with, and I'll let you name it, but maybe more complex autism as a younger child than how Olivia presents today. So we are excited to hear, and wherever you want to start with Olivia's story, I'm going to hand it to you. So, Nikki Tomczak, you're on.
Thank you so much for all the kind words and for having me, for sure. Our story is complicated. So because she's not 3 and she's not 8 and she's not 10, and as you know, like we've been doing this for 23 years, so it has a lot of ups and downs and all arounds. So she was considered severe and profound for probably the first 10 years. And so in the first 10 years, we did all the things that I think everybody else chases after, which is the therapies and the ABA and the speech. And, we went through the whole song and dance. And then we did have a couple things that happened that just kind of screamed that it was medical
Okay.
and that we needed to go down a medical road. So Olivia was nonverbal. And when I say nonverbal, I mean nonverbal. She did not have
Okay.
a single word, and she also had a difficult time. We couldn't even teach sign language. We even had a difficult time with that. She was not writing, she was not reading. So
Yeah.
she was completely nonverbal from about 1 is when she lost all of her speech, and almost until about 7 years old.
So Nikki, from like right around when she was hitting that toddler stage, like around the first birthday, she was starting to make like little sounds and trying to converse with you.
She had words.
Mhm.
She probably had about 5 or 6 words at that time,
Okay.
and then she did lose all
She
of.
lost them. Okay. Wow.
So she was completely, nonverbal until she was almost 7. So there was some things that happened here and there that kind of sent us in the direction of, okay, there's some medical things that are going on here. There's some underlying medical issues. And every time we would go to the doctor and we would say, well, what about this? Or what about this? Or she's constipated, or she's doing this, or this is happening. They would say, well, that's just part of having autism.
Okay.
So we were being ignored quite a bit.
Just
So
kind of brushed under the rug. Like,
yeah,
oh, there's
we were
physical symptoms.
kind of over and over and over. Well, sometimes kids are just born this way, or sometimes this is just part of having autism,
Right.
constipation, or all of the, underlying medical components. So we had a lot of different things that were going on when she was around 9 or 10. And actually, one of Marty's friends that he was friends with in high school was a nurse, and she had a nonprofit at the time called Autism is Medical. And
Mm-hmm.
she reached out to him and said, would you ask your wife if she would consider getting on the phone with me? I think I may be able to help you with your daughter.
Wow.
And big risk.
Yeah. Oh, big. Yes.
Yeah, because you don't know how a mom is going to handle that, or how she's going to receive
Right.
information that, I mean, how dare you think my
Exactly.
child,
Mm-hmm.
right? I was pretty desperate. Things were pretty bad. Olivia
Yeah.
at that time, if I could describe her, she was aggressive, um,
Mm-hmm.
extremely severe. She was eloping. She was harming herself, stool smearing, the works. And
Everything. Now, Nikki, she is your youngest of three, correct?
she is my youngest of 3. So while all this was going on, we were doing neurotypical life with our
With
other.
the other two.
And
Mm-hmm.
so we were doing softball and baseball and cheerleading and all.
Mm-hmm.
And so Olivia was unable to really leave the house at that
Mm-hmm.
point. So Marty and I would take turns on
Right.
who got to take which kid out of the house and who stayed back to care for Olivia. And it was about 10 years that we spent like that.
Wow.
So
That's a long time.
there's actually some people, all the way until my daughter graduated high school, there was people that thought that Marty and I were divorced because they had never seen us together.
And and that is one of the parts I think that people just never think about, the sacrifices autism families and couples make.
Yeah.
And it is, and that is an unbelievable strain on your marriage. And kudos to y'all for making it through that. And here you are still making funny TikToks all these years later.
There's some days that we definitely look at each other like, you know what? I can't even believe we made it to the
You
other
did it.
side. But we did. And that is something that you can't ever take away from us.
Oh, it's amazing. It's amazing because that is,
So we've
and
been
trying,
since the 90s.
I know. And trying to navigate your neurotypical children's lives and keep them as normal as possible and support them and truly enjoy their things when you have one at home that you have no answers for and that you're constantly concerned with is a burden like no other. So amazing. But okay, so carry on. Sorry.
So I was desperate, And
Mm-hmm.
I took the call, you know. And
Yeah.
so I remember when I talked to her, I remember feeling like I had no idea what she was talking about.
Yep.
The 27 specialists that we had already taken her to, trying to find answers, never mentioned any of these things that she was mentioning. She was saying all kinds of things that I had no clue what she was talking about. And she said, I think that she probably has mitochondrial disease. I don't know how to say that. You know, I had no idea what she was even saying.
Right.
I think that it sounds like she probably has something wrong with her stomach. She needs a GI specialist. She needs to see a neurologist. She needs this, she needs that. And I remember just being extremely overwhelmed. And
Mm-hmm.
I don't know if I thought she was crazy. I think it was clicking for me and it was
That
making sense.
I was going to ask you, like, in your mother gut, when she said that to you after you
Yeah.
have been living this very difficult life for almost a decade, was your mother gut feeling like, oh my God, she's right? Or was it to doubt her? Like,
No, so I really was thinking she was right.
mm-hmm.
All the things that I wanted her to be wrong about. Because for me, what that meant was I failed my daughter for 10 years
Yeah.
because I didn't find the correct answers.
Yeah.
And so it only took about 2 or 3 months after that for me to figure out she was right. And I needed to do whatever I needed to do to get her seen by the correct doctors so that we could get her the help that she needed. So at that point, I quit my job. I sucked out all of our retirement. I bought a physician's desk reference and
Wow.
a medical dictionary, and I read them until she got on the phone with me almost every single day while I waited on a waiting list to be seen by Richard Fry. He's
Yep.
yeah. So he's one of for people that don't know who that is, he's the doctor that was on the news for talking about leucovorin and speech and a folate deficiency in speech. And so we've been with him almost 14 years now. And
Yep.
so I did what we call the world tour, where I quit my job. I got all of her medical records. I put them out on the floor and I sold her furniture, you know, and I put all of her medical records out on the floor in chronological order from birth until at that point she was 10. And I thought, holy shit, she's right.
Yeah.
She's right.
Everything. So, Nikki, like, and Lisa and I are always like, every mom that listens is important, no matter how old your child is or whether you're listening and you don't even have a child on the spectrum. But for those younger mothers out there who, and when I say younger, I mean have younger children
Yeah,
who are desperately, like you and I were desperate at one point in our lives.
sure.
And, so the things that Olivia was exhibiting, like you were saying, like you said she was self-injurious, she was eloping, she
Yeah.
appeared to be in distress a
Oh,
lot of the time.
yeah, she was
Okay.
bearing, there was very little that she could handle. She couldn't handle someone walking into our home,
It
like
was too much.
a little
Uh-huh.
friend. She was wearing headphones. She would bang her head against the wall. She would pick out her belly, try and remove her belly button, her belly
Wow.
button.
Just
Um,
scratching at it. Okay.
she would pick off her freckles, part of her lips. And then fast forward after we did, so essentially what we did was we went and put a team of doctors in place that
Yep.
did a complete and full medical diagnostic workup, medical, and ran every lab and every test so that we could figure out what was going on, and so
Yes.
we did discover, multiple medical diagnoses. And once we started treatment, she was a very huge positive responder. Some treatments, it only took days to see a difference because what happened was she had a bunch of underlying medical issues that were not being addressed that
Yeah.
were now being addressed. And so those underlying medical issues were causing the autistic behaviors. And so a lot of her autistic behavior, does she still have autism? Yes. But
Right.
we are treating the underlying medical issues. And so she's
She's
not
getting relief. Like
anymore.
yeah.
Yeah. She's not even level 3 anymore. She's just kind of touching a level 2. And we just got that revised just a couple months ago. That's the only reason why I know that, because that's not language that was used
Yes.
when our kids were younger. So a lot of us that have the kids that are in their early 20s or even late teens, that's not language that was used for us. And so the only
Yes.
reason why I know that is because it was just revisited a couple months ago for Medicaid. And so it's in writing. So I was like, I know what level she is now.
I know what level she is. I know. And I think it is so important, like that people understand, like for moms, like I mean, you're younger than me, but in our general age group,
Yeah.
this is all new. This level thing, and,
Yeah.
and like referring to it and categorizing it that way is
So
just,
we're
it's a
from the time where it was high functioning, low functioning, or Asperger's. And so,
Asperger's, exactly. PDD, NOS, we
yeah,
got that one. All of that. That's the language and the way my brain thinks of it, simply because that was our experience.
yeah.
So it is so interesting. So, okay, so when you start figuring out how much of her autistic behaviors and the way she showed up in the world was due to these physiological conditions and these things that were happening to her, I'm like, so how did you choose what to tackle first? Like,
Okay.
or did the doctors kind of give you a pathway?
Yes. So that we definitely had to leave to the doctors.
Okay.
So it ended up that Olivia has autoimmune bowel disease. So
Okay.
that's a GI doctor. And
Okay.
then her neurologist discovered autonomic dysfunction, a folate deficiency in her brain, which is called a cerebral folate deficiency. So obviously, if we don't have enough folate, we're not going to function properly, right?
Right.
So
Right.
she didn't have any folate either, or it wasn't functioning properly because she didn't have enough folate in her brain. And she also has mitochondrial disease. And
Now, Nick, will you tell, and to educate me as well, and I know those are all big things. Can you give us like the layman's very quick synopsis of what those things are?
yeah, so the bowel disease, it's inflammatory bowel disease, which
Okay.
means the whole I'm not a GI specialist, so I'm actually going to get him he's going to do a video with me.
Okay.
Her doctor will, and she's been with the same one for 13, 14 years that only sees patients with autism. So he'll be able to explain it a lot better than I will, but her small bowel is extremely inflamed. It is autoimmune in nature. And
Okay.
so she does have flares up and down. And so you do need to treat that from an inflammatory standpoint.
Right.
So when we did the endoscopies and the pill cam to see what was going on, it was the very first time that she had ever been cleaned out from 10 years of constipation. And so
Yeah.
overnight, the next day, she never became aggressive with me ever again to this day, 14 years later.
Wow.
Yeah.
So, oh my gosh, so to me, like, it sounds like it's a very similar thing to like a Crohn's disease. Like, would it be similar in nature?
I would think so.
Yeah.
That's that I don't want to say it the wrong
No,
way.
right, right. But
Yeah.
like in that genre kind of
Yeah.
thing. Okay. Yeah.
So the way I got into this GI specialist, because he had a big giant waiting list, was 2 weeks before we actually saw him. She had attacked me in my front yard and got me on the ground. And so she knocked me over, which I think was unintentional. But then I think she got scared, and it was like a tussle. And at that point, she was not very big. She was probably like 70 pounds,
But yeah,
she had got me,
you're not very big either. Yeah. So yeah.
she got me like backwards, and I hit my head, and I told, my girlfriend about it, and she said, "Oh no, we're not going to do this waiting list. This is an emergency. We need to get you in."
We
So,
need to get in. Well, and if you think about, so many of our neurotransmitters, like everybody says, your gut is your second brain. If your gut's not working correctly,
so your gut is actually connected to your brain, but
to your brain. Yeah.
so she never ever, to this day, still ever has ever become aggressive with me ever again. I've never seen her push, kick, bite, spit, all of those things that she was doing. Never again. Now she can and will become verbally aggressive or assertive if she has a stomach ache. But now that she can speak and communicate, and she can kind of advocate for herself a little bit, and she can say, my stomach hurts,
My stomach hurts. Sure, she can tell you what's going on.
Yeah,
And
but
just imagine, I'm just trying to imagine the relief. Like if that was all she had ever known was feeling badly. Because
yeah,
I know, like, I mean, just a small stomach ache, period cramps, anything puts you in a bad mood,
for
makes
sure.
you feel tired, makes you feel distracted, makes you feel, I can't imagine a little girl,
Yeah. So
having lived with chronic pain.
when we're looking from a nonverbal standpoint, we have to be
Right.
thinking that behavior is communication. And I'm a little on the aggressive side if I'm not feeling good, right?
Yeah.
So, I mean, that's the one thing that genetics loaded the gun there for her.
Right.
Uh, I'm a little aggressive too, so
I
it
love it.
makes sense to me that if she's not able to verbally communicate what is going on, that
Right.
she's going to try to do that in a different way. You know, just because someone isn't verbal doesn't mean that they can't be assertive in a different way. And the only way that they have to be assertive is
Yep.
through behavior. So,
Yeah, that's all they have. Right. Exactly. That's fascinating. So that was number one. And then what was the next thing that y'all kind of attacked?
Autonomic dysfunction was a big piece.
Okay. Explain that to us.
So if I'm going to explain it in just mom terms so that another mom
Yes.
can understand, I just did a video on this the other day. Your enteric nervous system is responsible for your body just kind of shifting gears automatically. So
Okay.
it gets stuck if you have autonomic dysfunction. And that's a mom explaining it. So it can give a list of things that it can cause anywhere, fight or flight reactions, temperature dysregulation, problems using, the restroom,
Okay.
your blood pressure can drop, you can faint. I have a tiny bit of autonomic dysfunction. If I get super scared about something, I'll feel like it in the pit of my stomach and like I'm going to vomit. My lips will go a little pale. I have
Mm-hmm.
never fainted. I have a son who does faint, and it's from pain. So if he feels pain in a certain way,
Pass out.
just automatically want to go down. And
Wow.
Olivia, for her, it's more about fight or flight. And it's mostly not when she's upset about something, it's when she gets happy about something. So
Really? That's so interesting.
about like meet the teacher. She's super excited every year. She loves
Yeah.
school so much and she can't, the anticipation of getting there and meeting the teacher and dropping off the supplies. And then
Uh-huh.
she goes to the car and just completely loses it. Well, at that time, she will get big red splotches all over her skin that are warm to the touch, and her eyes will dilate. I got super duper duper lucky one day, and it happened in front of her neurologist. So she was
Wow.
excited to see him. She did this whole thing, and I was like, "What the hell,
That's
girl?
it.
Like, what is this?"
What's going on? Yes.
That's autonomic dysfunction. He's like, we can treat that. So it happens very rarely these days, but it's like she gets into it and then just can't reel it in and can't settle down. And I think that is a pretty important piece for a lot of our kids too.
Uh-huh. And so
Yeah.
what is the treatment? Is that a certain
Yeah,
medication?
we have her on a beta blocker. And
A
so
beta blocker.
a
Okay.
beta blocker kind of settles your enteric nervous system a little bit. If I see it now, it's it's very light and it's very quick and it's not
Kind of.
it's not as severe, but you can see like little red spots when she gets real excited. She was talking about her birthday earlier and she started to get red spots
Yeah.
and they went away right away. Now 10 or 15 years ago that would have been an all-out war zone,
Right, because if she can't speak and she's feeling all that internal
yeah,
chaos and she can't relieve it, of course, then she's going to act out. I mean, it all adds up. It all makes sense.
yeah.
Wow. I mean, this is all just fascinating to me. It really, really is. So we have the bowel disease, we have the autonomic nervous system dysfunction.
And then
What comes?
she has a cerebral folate deficiency.
That was the next thing.
She
Okay.
doesn't have enough folate in her brain.
Okay.
And we know that because we did a spinal tap. So you have to have enough folate for your brain to function properly.
Function.
And
Wow.
she is not making enough folate on her own. So that just for her specifically, because we know that she is not making enough folate on her own, And we know that she does not have enough folate in her brain. We did start her on an injection. We started on a tablet of folate. It's called leucovorin.
Yep.
It's been all over the news lately.
It has.
It's been out for a long, long time. We've been doing it 13 years. So she started with a tablet, which I don't remember seeing a whole lot from that. And then the doctor had suggested that we start an injection. And
Right.
within 24 hours, she was speaking in sentences.
Holy cow.
So at that point, we went from, first of all, the feeling behind that.
I can't imagine.
I don't cry on the internet, girl, but
Yeah.
I can remember it like it was yesterday.
Oh,
You know,
I'm sure it's etched in your brain forever.
So-
So she literally, you're trying the oral pill form of leucovorin, not getting huge results. You give her an injection, and in 24 hours, she's speaking to you.
we were asking her questions and she was just answering in sentences. And we
So
had
it had been in there all that time.
from like a year, or we probably have about 400 videos for that year. Yeah. Where I just sit next to her. And so we call it the question videos. This is one of the reasons why we started a TikTok page. So she loves to sit down and be interviewed and for you just to ask her questions and have her answer. And so we would just say, you know, how was your day today? And she would say, so many things would come out. Well, my teacher and her husband are fighting and they're going to get a divorce.
Like all these things. You're like, what?
Yeah. So we did at that time, I think when we started, we were only doing them a couple times a week. And so we noticed that her speech would come and go. So she would get the injection and she would be able to answer questions. A lot of it at that time, I feel, was very difficult for the outside world to understand, but we could understand everything she was saying. Because I review those videos every once in a while. And so her articulation still needs work now, but I can still understand everything that she's saying in those videos, you know.
Wow.
So we, at that time, he had decided, okay, if she's going to keep losing speech in between the every couple days of injections, let's go ahead and see how she tolerates continuing to add another injection until she's taking them every single day.
Okay. So her speech would wane between injections, like it would drop off a cliff kind of, and then come back as you gave her more.
Yeah, she wouldn't lose all of it, but you could tell there was a big, big difference, not only in the amount that she would speak, but what she was speaking about, complex thoughts and ideas, articulation. I can tell you right now, I can tell a difference between when she's had an injection just by listening to her open her mouth and say one word. So every once in a while I'll say, okay, all right, fine. We don't have to do one tonight. We'll do it tomorrow morning, you know?
Right.
And I can tell immediately if Marty forgot to give it to her the night before. So she still does do them every single day.
Got you.
And in the beginning, it was a lot of bribery and crying and begging and pleading and promising, you know, trips to Hawaii and all the things, right?
Whatever.
Yeah, whatever works, right? I'm not against it. I'm not above it.
Me either.
Now she just comes right up and says, you know, come on, let's do it, you know.
Let's do it, because she probably knows she feels better. Yeah.
Sure. So, and then at that time when we figured out that when we were giving them to her 7 days a week, that she was conversational, we did decide to do infusions, IV infusions at that point.
Okay. So is that in addition to the daily injection or instead of?
So she does all three. So she does oral in a pill form, and then she does daily injections in the arm, which I know a lot of people don't do them in the arm, but Olivia's 23 and she's female, and that's where she wants us to do them.
That's where she wants you to stick her. Exactly.
She wants us to do them on her booty. So
yeah,
that's fine.
I can understand that. Yeah.
And I'm fine with that. And the IV infusions, we didn't start those until a couple years later. And they're sporadic. So there's not a regular schedule with those.
Okay.
Because of the autoimmune disorder in her stomach, she has another autoimmune disorder as well. She does do IVIG every month.
Yeah.
Take globulins, and then at that time when she gets those, we'll drop a leucovorin infusion in there.
And just go ahead and do it all at once. Got you.
So it's
Nikki, this is fascinating. And, like as we say every week, everyone's story and every single mother we talk to, everybody's story is so unique and the way they approached it and the things that work for their child. And I think that is so important. And Betsy Russ, that was on last week, she was just the way she put it so beautifully was like, what we want from this podcast and what I think you want and I want and Betsy wants and Lise wants, we all need to just be respecting and supporting and learning from each other, because all I would want from someone hearing your story is maybe if their little boy or girl is showing these signs of distress or showing the same type of thing, maybe you saying that is going to take them to the right doctor
yeah,
and they're going to get the answer that they so desperately need. Or maybe somebody heard Betsy last week and she's talking about spelling to communicate and they've been wondering about it. And now they go do it and then it helps their child learn to communicate,
yeah,
and that is the whole point of this podcast. So
yeah.
I just love that you're telling us all these new things.
I have friends that have done, we all walk the walk and we all
Yep.
have a different one, right? And so I
Very
have
different.
friends that have done all kinds of different things. It just, depends. I still learn from other people every day, and not just
Yes.
the ones that walked before me, the ones that are walking after me.
Me too.
So it's very important for people to share their stories. Right now, my page is a hot topic because I did do a video that said that she's been on the leucovorin for 13 years. And so what I'm seeing a lot of is, well, first of all, I'm getting anywhere between 200 and 500 messages a day right now. And
Wow.
a lot of what I'm getting is from people saying, well, what was the milligrams? Who do I ask? It's not that simple. And I
You
wish
can't say that. Yeah.
that it was. And I can tell you that Olivia's dosages are not even in the same planet as what other people are discussing. I can't say every child is so different.
Yeah.
They may have something else going on. They may have a seizure disorder. They may have
Right.
so many different there's so many different things to consider, and that is a doctor question all day long.
Mm-hmm.
But I see a lot of people that want a very quick fix or some sort of relief, and it's just not how it works. Our medical journey has been well over a decade long.
Yeah.
It took years to do a full medical diagnostic workup. It took years to be adding in her entire treatment plan that she's currently on. It took years for us to get to the other side of crisis.
Yeah.
So I wish that it was that easy, but it's not. And I hear a lot, there's so many different barriers depending on the family. Every family is so different.
Yeah.
You have to choose, you and I discussed this before, you have to choose, where does your money get allocated, and
Yeah.
how much money can actually come in. So you have to make some really tough choices.
You do.
So
And that's just a reality. There's no right, wrong, good, bad to any of that. It's just a reality. And every family faces it. And anybody who is ugly to people about that fact needs to go home and sit down, because
we don't
it's
have
hard.
unlimited money. I
Neither did we.
had to suck money out of my retirement and sell
Mhm.
furniture just so we could get on the plane and go. And then when we got there, it took 8 of us to hold her down for labs, so it's not been easy. It certainly wasn't overnight, but I feel like if people do share their stories, that there may be something that may help. Maybe it's
Yes.
not going to help every kid. Maybe it's
Right.
going to help one. And for a long time, I really felt like I was getting a little too tired for this, and I really didn't want to.
Mhm.
I wanted to take a step back and just not even say the word autism anymore,
Yep.
so that I could just take a breather for a minute, and then I can hear, I can see, and I can literally feel the desperation in these mothers.
Mhm.
I
I
can
know.
feel it like it was yesterday.
Yeah.
And I definitely am feeling like maybe I got a little bit more to give, and it's my time
You
to go forward.
You do. And I would encourage everyone, please, if you're listening, are you on Instagram too, or is it just only TikTok?
I don't want to say anything on air that gets me in trouble, but I'm not on Instagram.
Okay. Yeah, but Nikki's and Marty's page, their pages together, Marty and Nikki with 2 Ks, is so informative. Like she has got some really good stuff on there.
Yeah, we're trying to come up with a plan. So I kind of started writing a book.
Oh,
I'm
amazing.
thinking I'm going to get to the end of it this time where I'm going to write a book about the medical journey where I can go into really great detail. So again, if it can help someone, if one piece of it can help one person, another piece of it can help another, because all of our kids are so different. I feel like now that we are on the other side of crisis, I feel like maybe it's my time to pay it
It's your
forward.
time.
Like I said, I had another mom. There was two moms that were nurses that were part of a nonprofit. That girl, they got on the phone with me every day,
Isn't it? Oh,
and they walked for years until
yeah.
they got me to the other side, so that I could at least participate in a medical conversation and follow along, so that I could help my child.
Yeah.
And that's what they did for me. And
Well, it is miraculous. I mean, looking at cute little Olivia sitting there beside you, you know, conversing with me and thinking that that's where you started from. It is miraculous to think about what you have done.
yes, I think that, that part is really important too, because I feel like a lot of times people will see someone who is functioning
Well,
different or different than their child, and they think, well, they don't know what real autism is. Okay, let me be really clear. You like my bluntness? I'm going to be clear. We've been kicked out of hospitals.
mm-hmm.
My husband has been kicked out of a hospital. Okay.
Yeah.
I've already said, I've been knocked to the ground. I've been stuck on the ground of a Walmart. I've been stuck on the ground of a baseball field.
Yeah.
So I do get it. And she's
You do.
very severe. We are on the other side of crisis now,
Yes.
but the treatment that we have to do for all of these underlying medical issues will never go away.
That was going to be my next question. So what your medical plan that you are always, I'm sure, always fine tuning and always tailoring, you know, as she grows and changes and matures, this will be a lifelong journey.
This is a lifer. Yeah.
Okay,
Yeah.
got you. Because she'll never, like, these are things that will continuously need to be treated for her.
Yes.
Okay, got you. But it's not like you get to an end point.
No.
Okay.
It's forever. So she has mitochondrial disease. And
Mm-hmm.
so your mitochondria is inside every single one
Yeah.
of the cells, and it's like the gasoline that
Yeah.
function, right? She not only does not have enough, but also the ones that she has are not functioning properly. And so a lot of times when someone has, and so she's zapping energy to use, she has no heart issues, no liver issues, no kidney issues.
Right.
So her mitochondria is helping all that work, and it's not helping all of this work. And so it's
Okay,
dropping out before we get here. Yeah.
I
And
got you.
she does not have enough energy to go around. And so every morning when she wakes up, we have to fill her with a bunch of supports in place that are prescribed by her doctor. There's a special compound that's put together for her to help give her some of that energy. In the evening, when some of those supports wear off, she does struggle.
Yeah.
And look at her and tell that she is done. She's zapped out.
Yep.
If she was not able 10 years ago, Olivia, if she was not able to communicate, that would come out behaviorally. That's going to come
Yes.
out as a fit. That's going to come out from a behavioral standpoint. Right now, Olivia's going to say, I'm out. I'm going to bed.
I'm tired. Right. I'm tired. Yeah. And she can verbalize it and tell
Right.
you now.
Yeah.
Wow.
So
I'm just, you know, I'm just thinking of like all the moms out there though that maybe have no idea where to begin. You know, have never even heard these terms or thought about the possibility that there might be something medical driving some of the behavior or worsening or exacerbating behavior. And maybe just you telling this story is going to take them to the right specialist, to the right, the right nurse, the right doctor. It could be life changing.
if I could say anything about that, I would say it's not going to be one doctor.
Right.
Not going to be your pediatrician.
Mhm.
There's
No.
going to be specialists. There's going to be more than one involved, and there will need to be some sort of workup. And it's individualized per child, right? So my daughter was having constipation issues, and she was stool smearing, and
Yeah.
we had those types. She was getting the red splotches, and she had horrible anxiety and OCD, and the sensory issues were they were pretty tough for a while. She
For a long
couldn't
time.
walk into a store. If she walked into a store, she would just hit the ground and scream like a banshee. And I know that a lot of people are going to understand what I just said.
Oh yeah. Oh yeah.
We spent years like that. And the medical treatments that we did for her, it took that away. That's not a thing. There's 70 videos on this page of Olivia inside the middle of the mall with me, picking out clothes and paying for her stuff. And there's music and all kinds of stuff, and she's fine. There's also
And
video
she's
of
fine.
her at a concert.
Yeah.
She hasn't worn headphones in over a decade. So there was a lot of underlying medical things that were going on that were causing behaviors, and when we started treating those, a lot of those behaviors either A, completely vanished, or B, have greatly improved.
Greatly improved. Wow.
Mm-hmm.
That is so, Nikki, take me back. Like what would you say gave you like, I mean, that's a hard road, especially on your baby child, like your last one, because I know by the time I had Maverick, now granted my special needs one came earlier in life, but I mean, by the last one, you're like, I need an easy one. I want to ride, you know what I mean? I want to coast on this one. I really don't want to work that hard anymore. So what do you think in you gave you like the grit and the determination to get through it, parent your other children? I mean, that is a lot. Like, we always like to know, like, what did you lean on? What were the pillars in your life? Like, was it church? Was it girlfriends? Was it your female family members? Was it you and your husband's relationship? What would you say were the big things that got you through those 10 years?
That's a tough question
It
because
is.
I come from a background that's not perfect.
Mm-hmm. Mm-hmm.
I don't have a family to lean back on.
A ton of support system. Yeah. Mhm.
And I think that how I was raised in my childhood is really makes me, it's what makes me who I am.
Just made you strong. Yeah. It
Yeah,
just made.
a fighter since birth. So it was not easy. It was definitely hard. And I feel like I just didn't have any other choice.
You just did it.
The
Mm-hmm.
only thing that kept me going was the fact that I loved my daughter and I wanted to make sure that she was able to live the best possible life.
Possible life. Oh,
And at that moment, she was not. And so
yeah.
if you gave me something that a doctor said we needed to test, there was a
We're
lot
going to do it.
that we did with everyone in the room in full tears, including me, while I was holding her down. And that's at the end of the day, now that we're on the other side of crisis,
It's what you had to do.
it
Mm-hmm.
helped her. I had no choice. Yes.
Yeah.
If your kid has diabetes, are you going to tell them that's okay? You don't need your insulin? No.
Because you don't like a needle. Right. Exactly. No, you're going to give them the insulin. Yeah, exactly. Exactly.
She had issues that need to be treated, and that's how we did it. Now, the therapies that she was doing up until we started discovering the underlying medical issues, nothing worked ever at all. Ever. It just was.
Okay. Yeah. I'm very interested in that. Like, what else did you try before you did the medical stuff? What were the big ones?
We were a very short-lived ABA, but we did
Okay.
speech therapy, occupational therapy, and physical therapy 4 days a week for 10 years.
And all of it, no bueno, like
No.
just nothing.
The moment
Okay.
we started the medical stuff, all of it, right now, she's a huge responder to therapy. Huge.
Wow.
So she will do anything that you ask her to do. She thinks it's like a fun time,
Right.
Any kind of therapy, she's like, yeah, let's do it.
Like, this is fun. This is interaction. Like, let's have a great, but because her body is regulated enough that she can enjoy and engage and
Sure.
feel comfortable. Right.
Better. Yeah, she feels
yeah.
better. So she's able to listen and follow directions. She still does have some auditory processing issues.
Yeah.
We do still have some issues with communication. Listen, we have a long way to go.
Oh yeah, us too. Mm-hmm.
We're light years away from where we were. And that, I feel, is very important for the younger families to hear.
Yes.
Yes, we need to be focused on how far we have to go, but don't ever forget where you came from.
Where you came from. Oh yeah. And celebrate it every day.
That's right. Yeah. So, we still, Olivia does a work program. Is it a work program like other kids her age? Is it work the same that other kids her age are doing? No.
No.
But did she get a little paycheck and we went and celebrated? Yes, of course we did. It's a very big deal for her. 10 years ago, I would have said, there's no friggin' way she's going to be able to leave the
Yeah.
house to do
Like
that.
she'll never leave your house.
And
Right.
she's
Exactly.
on her own. She's earning it. So we went to the bank and made a big deal and had her
I
cash.
love it.
You know, we
That's so fun.
and we let her, spend her money. And then we had a talk with her that next week we're going to have to work on budgeting, little girl.
Right.
Because so we're going to work on, taking the photographs of the check and putting it in the banking app, and then how much are we going to save and how much are we going to spend. And
I love it.
I'm going to have to, really make a rule with myself that when we take her somewhere and she says, can I have this shirt? And she only has $20, I have to say,
Right.
if you don't have enough money, we can't get it this week. We have to save for more.
Yeah.
So, and that I'm going to work really hard to do that,
Amazing.
She's
But
worked so hard. I mean, this little girl has busted her ass her whole freaking life. I feel
fights
like
to get where she is.
shirt, I want to buy her the shirt, but now
I know.
we're kind of reaching the point where I'm like, okay, I'm not doing her any favors. So we're going to have to
Yeah.
start working on what's the next step. I can't believe we got this far, but here we are. And now we're going to work on budgeting. So
I mean, it's amazing. And the fact that you went from, her not being able to leave the house to now talking about budgeting. I mean, that's a miracle
which
right
is
there. I
literally
mean,
wild, right?
yeah.
When she started speaking in the sentences after we started treating the folate deficiency, I felt like, do I even know how to parent her anymore?
Right.
Right. Like, because you have to change everything up.
Everything. Yeah.
She was essentially, at that point, she was essentially nonverbal, not all the way. She had, she would speak sporadically, 10 words or so.
Right.
So she was saying yes, no. She could say drink, more, things like that. Very, very basic commands. And then we went to pretty much overnight where she was actually answering questions with like sentences. It was really wild. And I almost needed therapy because of it.
I
Because
bet. Such a
questioning,
shock to your system. Yeah.
I was questioning like, hold on, am I even doing am I doing her justice? Like, am I doing the right thing for her? Should I be telling her no more? Like what? Like I really had a hard time wrapping my head around.
I mean, yeah, that's like literally turning your life up in the best way, but it's still turning your life upside down.
Yeah.
So that segues us, I think, if you're good to still keep talking about the impact on you emotionally and physically and everything else that parenting a child with that great of needs has, and then watching them go through these huge changes. So you have already survived a heart attack and you're in your late, is it okay to say your age?
Yeah.
Yeah.
That's really important. I just turned 47
Yep.
in June, and I had a heart attack 5 months ago. So,
And that was one of the main video series that I had seen you briefly before talking about Olivia, but I really found Nikki when she was documenting her journey after the heart attack. And I was looking at this gorgeous young looking woman and thinking, oh my Lord, she's already had a heart attack. So tell us about that.
yeah, so I actually was out in public in a store with Olivia alone.
Mm-hmm.
And I had some symptoms first thing in the morning when I woke up. I had up from work and I said, I'm not feeling right. I got something going on. I don't know what's going on. I think I'm going to take a shower, see if I feel better. Just hold on a second. Don't go anywhere, And so I took a shower. I felt better. And I said, all right, I'm feeling better. I had a doctor's appointment that morning. I actually had the flu and pneumonia in December.
Okay.
They wanted me to go back 6 weeks later to do a chest x-ray just to make sure that the pneumonia had cleared. And so just a follow-up, I felt fine. So I was going in for a follow-up to get the chest x-ray to make sure that I wasn't sick anymore. And so I said, I feel better. Go ahead and go to work. I'll tell him everything that happened. It was a pulmonologist office. So it wasn't, I thought a pulmonologist would surely be able to tell if I was, I honestly was thinking it was my lung.
Yeah. Like a collapsed lung or something like that. Yeah.
So I didn't know what it was. So I said, I promised I would, when I got there, I would tell him exactly what happened. And I had a sore shoulder. I had some pain that went down my arm.
Oh, goodness.
And
Oh, Nikki, you still there? So sorry. I'm not exactly sure what happened. Sorry about that.
no, that's okay.
So you said you would tell the doctor.
Yes, I promised that I would tell the doctor what happened, which was shoulder, arm, a little something in the middle of my chest. And I felt like I was going to throw up. I said, if he tells me that, I should go to the ER, I said, I'll call you. I'll let you know. You can meet me there and grab Olivia. And I told the doctor everything that happened. I specifically asked him, I said, it was the weirdest thing. I've never felt anything like this before. It was almost like a squeezing. I don't know. It was strange.
Oh, so scary.
I had this thing, this pain going down my arm, and then I felt like it's going to throw up. I was like, and then I took a shower and I was fine.
As classic. Yeah.
And it kind of was classic. It never crossed my mind because
right.
I'm 118 pounds.
Yeah. Right. You're trim, you're fit. Yeah.
I'm 46. I don't drink. I don't do drugs. I eat pretty good.
Yeah.
And so, I'm not perfect, but I live a pretty healthy lifestyle.
Right. And you're thinking, I'm in very decent health at 46. Yeah.
Really just never really crossed my mind. I don't have diabetes. I'm not on any medications. Like
it wouldn't cross mine either. Huh?
So he said, well, sometimes our body can give us a warning shot when something is wrong, and then it kind of corrects itself. So if it happens again, go to the emergency room. And I said, are you sure I shouldn't go now? Because you don't think it was my heart or my lung or something. I don't know. I said, my husband's in the area and he's willing to meet me there if we need to go. And he said, no, I don't think that you should go now, because if you go now, you're not symptomatic. So they're not going to be able to tell what's going on because you don't have symptoms. And so, he was obviously wrong. So that's
right.
That's not true. So I left his office. We went to lunch. I walked out of lunch. I started to feel it just in the middle of my chest again.
Oh, so scary.
And I called Marty and I thought, this has got to be heartburn. I just ate.
Yeah.
And it's the first time I ate all day. It's got to be heartburn. And I've never had heartburn before. So I was trying to explain it away.
Rationalize it. Yeah.
We went into the store and we went about 2 minutes away into a store. Louis Vuitton of all places. Don't even.
Oh no.
Yes, I was picking up my anniversary purse. Yeah.
Oh.
So, and everyone's like, you had a heart attack because you were in Louis Vuitton, but I was just picking it up. It was already paid for.
Right. Exactly. It wasn't the price tag. Yeah.
As soon as we walked in, I started feeling the whole arm thing again, the middle of my chest, and I felt like I was going to throw up. And I texted Marty going to ER. I went to go grab Olivia, like kind of just to guide her. And autism reared its ugly head. I was with a kid that had autism, Yeah. So I said, honey, I think we're going to have to go back to the doctor real quick. And I'm trying to, guide her out.
Move her.
She said, what? We're not going to go to Aerie after this?
Because you're disrupting her routine or her expectation. Yeah.
So I started to do the math in my head, and I looked I was walking out of the store. I turned, there was a big giant mirror on the wall, and I looked at the mirror and I didn't even recognize myself. I was
like gray. I was going to say probably all the blood. Yeah. Oh, Nikki. Oh my God.
And I was sweating right through my clothes. And I never did math so quick in my head. From there to the door, I thought 4 minutes for the ambulance to get here, 2 minutes to argue with her to get in, 2 minutes to pick me up, 2 minutes to get to the hospital. I'll be dead. And
oh my God.
So I got her outside, and my car was parked right there in the front. And I said, hurry up, get in. And she hurried up and she got in. And the GPS shows that I arrived just under 3 minutes. And
you drove yourself having a heart attack.
And then when I got there, I walked in and it only took, there was a nurse that was standing right behind the counter. I just kind of did like a tap on the counter. I was shaken by the time I got there because I was probably in shock. So there was a nurse that saw me from the other side, right on the other side of the receptionist counter. And as soon as he locked eyes with me, I knew I was having a heart attack because he was like, yeah. They all came running and they called. So they actually hooked me up to the EKG machine right on the other side of the receptionist desk. I never made it to a back room or anything like that. And then they called a code right there and they had me up being, so at that time, Olivia was still with me. So I dragged her with me on the other side of the receptionist counter, and my family was on their way to me.
Yeah.
Receptionist was screaming for Olivia to go in the waiting room. I was screaming that she wasn't going anywhere.
Right. You're like, no, she's right. Mm-hmm.
And then Olivia started yelling, "I can't go. That's my mom." Yeah.
Oh,
Yeah. So
well,
then
and
here, my oldest daughter was like, "Olivia, walk to me. Olivia, walk to me. Olivia, walk to me." And I said, "That's my daughter. That's my daughter. Let her go." And then they wheeled me like, quick.
away.
Yeah.
Now, and how long were you in the, like, what did you have to have surgery, or did you have?
So they took me up to the cath lab like right then. So I went straight from the receptionist counter to the prep area for cath, and then they
Yeah.
took me upstairs for cath. And then I didn't need surgery. So my left main coronary artery, which is your widowmaker,
Mm-hmm.
it spasmed and then clamped down and got stuck. So
Wow.
they did give me nitro under my tongue down in the emergency room that didn't touch it, so
Yeah.
it stuck. So they shot nitro directly at my heart, and they had to do it twice. Now,
Whoa.
everyone, and and immediately the second time they did it, I was like, oh, there we go, I'm good,
Yeah.
And he was
You
like,
could
oh,
feel it.
yeah, I was like, my shoulder pain is gone, my arm pain is gone, I'm ready to party,
Wow.
yeah.
Oh my
Yeah, so a lot of people are very upset that I drove, and I get it, I get it, but I will tell you, until you're faced with a
You're
decision
right.
like that you have seconds to make. There was many nurses and doctors in that hospital that said, if I would have called that ambulance since the nitro didn't work under my tongue in the air, I would have been in cardiac arrest by the time they got me, period.
Full. Yeah.
And so
Wow.
they would never tell someone to drive. They're like, we would never say that. Don't ever drive. Call an ambulance.
Right.
They could have shocked you in the ambulance, like you would have been with emergency medical technicians. In the car, you would not have had that. So we would never tell someone to drive. However, you would have been, absolutely, your heart was about to stop. You had
Right. And it was one of those situations where coulda, woulda, shoulda. I mean,
Oh yeah,
you're alive. I mean, you're alive, and Olivia's okay. Yeah.
I did not ever do that again. I did need emergency care twice after that, 3 times after the heart attack, because I was continuing to have problems with my heart. So there was like after shocks and waves that were freaking me out. I did call an ambulance all of those times. Even with Marty with me, we did call an ambulance. So I wouldn't do it again. But on that day, I had seconds to make a decision.
you were having a heart attack. Yeah. I mean, you were literally having a heart attack.
That
Yeah.
is how I made the decision,
Yeah.
So
But, and isn't that to me too, just like anyone that would like question your choices in that moment? It's the same as like questioning how someone parents their autistic child. I'm like, we're all doing the best we can
yeah.
with what we know in that moment.
I feel like in that moment, I did the best I could. And
Right. You were having a heart attack.
I was choosing to live,
Yeah,
I had to make a
absolutely.
decision at that
And
point.
making the decision that would traumatize Olivia the least. And I thought you did a beautiful job on TikTok of addressing that portion of it. And you did a good many videos talking about like having a plan in place
Yes.
for you, because it kind of brought that to the forefront of your mind to
Yeah.
always be thinking about, we need to have a plan. Well, I'm the primary caregiver. I'm the rock for this child. What if I'm gone? What if I'm hurt? And I remember thinking that, listen, and that what your videos were something that spurred us on to make sure that my oldest daughter and her husband are legally lined up
Yes.
to handle Tanner's affairs should Mark or I become unavailable,
Yes.
Yeah.
Absolutely. I mean, there's so many moving parts when
There are.
turns 18. So, we have full guardianship, but then I started to think, oh my gosh, we have a big long list of things now that we need to start checking.
Yeah.
That we have everything in place. Now, as far as Olivia giving a hard time because of the transition and not wanting to get in the ambulance and all that kind of stuff, we've worked on that since the heart attack. I don't think she would give a hard time anymore. So we've had her get on an ambulance a few times.
Yeah. Which is, but why would you, you would never do that until it happened to you. Because I mean, no one thinks it's going to happen to you, but it does,
Yeah.
and then, I mean, but that's when you learn these things. But maybe us saying it here will motivate other parents to be super proactive and be ready, even earlier, because I certainly would never have been ready for something like that.
I don't think that she understood what was happening.
How sick you were. Yeah.
Yeah, she did not understand what was happening. Now, since the heart attack, we've gone to a few festivals and we've let her go get on the ambulance and look around. She's also been to almost every one of my doctor's appointments with me since the heart attack, and there's fun, so that she sees mom being the patient and not just her being the patient.
Yeah.
And she's done very well. So I don't think that we would have a hard time again. So we're going over emergency. What's an emergency? What words are we using when it's time to be quiet and just follow directions?
Right. And do what needs to be done. Yeah.
She yelled at me the whole way to the hospital that she didn't want to miss her dance class. So she did not understand.
She was not understanding how sick you were. Right. Oh, sure.
So,
and if she
and I think maybe she does now. I think she understands that this was a big deal and that mom was very sick,
Well, Nikki, that brings me to hearing that, that what you went through. For our mom listeners, just the importance of what the long-term stressors and living the autism parenting life, and the unbelievable amount of extra stress and extra worry and extra pressure that it brings to us, what it can do to you physically. Even when you get on the other side, we still carry battle scars. Mark and I always say, we are still married. Praise God, thank the Lord, and we're so grateful to be. But I mean, it is not without scars. My other children are not without scars. They carry some weight of having grown up, with divided attention from parents, and like you said, both parents not being able to attend because one had to stay. And you're a perfect example of someone who is, not a risk factor person, but the stress and the load of what you have carried for years and years and years probably caught you,
Right now, and this could change. So right now, at this moment, every test that we have done regarding my health has been normal, except for my cortisol. So that is the only one, and it was low. So I did not have blockage. I didn't have a clot. My calcium score is 0.
That's crazy.
My stomach looks like I'm 26 years old.
Yeah.
Everything is A-okay, perfect. Even my hormones look great.
Lucky you.
That's coming. That's next. That's going to be the next.
No, we're going to believe that you're going to be fine for a long time. Hold on to that.
My cortisol was the only thing that was actually low. And so they say that sometimes when you have a very long extended period of high stress, that it can lower your cortisol instead of raising it. Yeah.
But, I think that's such a reminder, to moms to, no matter what you have to sacrifice, or if you possibly can. And I know sometimes you just can't, certain seasons, but make that time for yourself. Get a counselor, get a girlfriend, get a sister, get a mom, get somebody that you can just dump to, and get all of that out. Find something to nurture yourself, whether that's working out or gardening or reading or riding your bike or taking walks, whatever it is. It's such a reminder that we don't even, it's kind of, I feel like when you're a special needs mom, you have no idea what you're carrying, because you just, like you said, you just carry it. You just do it.
Just all the time. Yeah.
Yeah. And you just do it.
I've been balls to the wall for 23 years, and it is interesting how this all happened after things slowed down a little bit.
Right.
And so my son did have a major ATV accident in November. I was very upset. So there's no question about that.
That contributed.
Off of 20-something years of balls to the wall stress.
Yeah. Stress all the time, and worry and constant unknowns. It's unbelievable. And I am certainly not comparing anything to a heart attack, but I do remember during what we call like the bad years, the hard years, I would say the first 10 years after diagnosis were really difficult. I remember the same sort of thing. Like we'd go through a particular crisis point, like something would be either a school decision or a therapy not working or financial, setback or whatever. We'd go through some really big crisis and I'd be really strong through the crisis. And then we would move through and he would actually make some progress or the situation will resolve. And I would feel bad, physically bad,
Yeah.
when things were better.
Yeah.
And it is amazing how our bodies do that, but we need to listen to them and we
Yeah,
need to be nicer to ourselves.
this heart attack was 1 week, exactly 1 week after my son's last surgery.
Right. When he was supposedly better. Yeah.
Yeah.
It's almost like,
Yeah.
as a mom, you have to hold it together for everybody else. And then once they're okay, you can allow your body to fall apart. It's
Yeah.
amazing how we do that as women. It's just amazing how that happens. But I really hope that I know I did not do a very good job of like in a healthy way getting it out when I was younger. I held so much in. I held so much frustration and resentment and anger in, and just confusion and feelings of like helplessness and feelings of just feeling like a failure because I felt like I wasn't helping him and I felt like I wasn't finding the right thing for so long. And that's just all really negative stuff to have bottled up inside you. And
Yeah.
so I hope anybody listening to this will take that as, be nice to yourself. It is a hard, long road,
Yeah.
and give yourself a lot of credit if you're parenting through the special needs scenario because it's rough.
It's a marathon, not a sprint. And so
Yes.
we speed up to slow down, speed up to slow down. And so, you can be doing it 3 years, 4 years, 5 years. And I think it's very difficult to wrap your head around, oh my gosh, I'm still going to be doing this 20 years from now. I'm still
I
going to
know.
be doing this 25 years from now. And so you want to do everything at full speed. And I
Right.
think, it can catch up with you for sure. So
It really can.
heart attack, I've been saying yes to all kinds of things that I normally would say, I don't really have time for that. So I just got a pair of roller skates and I just got a new bike and
I love it.
we went zip lining for my birthday because I haven't, didn't do that. So it's been interesting the last couple months where I'm like, I'm going to start saying yes to some things
Yes.
that are super unimportant that don't have a whole bunch of meaning in
Yeah.
medical journey, in our autism journey, in my other adult kids. And it's just going to be about doing something that is completely unimportant, spending my time focusing on that sometimes.
And you said the other day on Sunday, I believe you said you had a nice day date with your husband. I mean, and that is so important to you, getting away with your partner, your spouse, whoever you're with, whatever your relationship is, just having that time where you are not just entrenched in autism 24/7. It
Yeah.
really is so important to have those mental breaks from it. It
Yeah.
really is. Well,
Yeah,
I
we
feel like I feel like I could talk to you for like 5 hours. I feel like there's so much more. I mean, you've said a lot,
Yeah.
but
The hardest part about our journey when you're talking to a mom that's been doing it for so long is there's no way we can shorten it because our child's not 3, they're not 8, they're not 10. She's
right
23. So we've done 23 years
worth of stuff.
journey, and there's no way that you could. So I really am. I'm actually on chapter 4 of the book. So
I can't wait to read it.
I think that it might be the right time for me to get to the finish
To do it.
line. Yeah. So.
Oh, you need to do it. You're a gifted storyteller. You're entertaining. You're a great speaker. You're very easy to listen to. I would love to read a book you would write. I think it's an amazing goal. You need to do it. It'd be so cool.
It could really help a lot of people. So
yeah,
thinking about sharing the medical journey in just chronological order of this is what happened. And so if, like I said, there might be someone who can learn from chapter 2 and someone that can learn from chapter 10,
right.
someone that can
right.
Everyone is so different. But we've done it all.
Yeah. And people need, and that I'm just so thankful that you agreed to come on because this is a different story, a different way of approaching autism, a different way of, getting to the root of a lot of the child's issues and a lot of other stories that we've heard. And that is our whole goal, is to bring on a whole different variety of mothers who are going to, because it's just so complex. You just, everybody is so different. And, Lisa and I are just always just amazed, even within just the little cast of Love on the Spectrum. And now that we have talked to every mom, how unbelievably different are, even though there are similarities on the surface, when you get down to the bottom, they were so different. And what's going on in those brains and what's going on in those bodies is so different. And, that's where the love and the tolerance and the support and just honoring everyone's journey and learning what you can for them, and what you don't relate to, just support them and cheer them on, because everybody's fighting an incredibly hard battle and literally trying to figure out a mystery. Every one of us is trying to figure out the mystery of our child and why he or she is affected the way that they are or presents the way that they do. And it's a tough thing to go through, but you have done a beautiful job and your story is fascinating.
Thank you.
It really. So, okay, before we wrap it up, I always liked for our moms to say, like, what is your, and I know this is a big question, so if you need to condense it down, that's fine. Like, what is your best piece of advice? Like, if you could go back and talk to yourself when Olivia was newly diagnosed or when she was a few years into diagnosis, what would you tell that young mom?
Oh, yeah, that's a tough one.
It is. I know it is a hard one.
Yeah, that's a tough one. I mean, I think that when people talk about it's a marathon, not a sprint, I think that that's
Mm-hmm.
really important. And I think that the self-care, it goes a long way. I will say this. I don't think that I took care of myself until probably 3 months ago.
Wow. Well, you look fantastic. So you've weathered the storm really well.
There's a lot of Botox going on here, girl.
Yeah.
We did not do day dates. We did not do dates. We did not focus on a lot of, the self-care and
Couple care.
things
Mhm.
like that. And so we have a lot of catch up to do. We have a lot of now is our time to, take a breather for a second sometimes and try and enjoy each other. But there was a lot of times where we did not do that. And that did not make me the best wife. And that did not make me the best mother. And that did not make me the best person, because I was balls to the wall the whole time
Always.
with one, if not one kid, the other kid, right?
Yeah.
Yeah, there's always something going on with a kid. So
Always.
I would say to, not forget that you're a person too.
Yeah.
But
Mhm.
obviously for us, since we had such a wild and still continuing medical journey, I would say that if you feel that your child has something going on, underlying medical issue that is
Right.
causing these behaviors, a lot of people will say, well, my pediatrician won't do this, or we don't have anyone in my area. And so here's going to be the blunt, Nikki. Get in a
Go for it.
drive.
I love it.
Get on a plane
And fly.
go.
Yeah.
If you don't have the money, raise it.
Mm-hmm.
Tap into your equity in your house if you have to.
Do what you have to do.
Yeah, do whatever you have to do. Sell something.
Yeah.
Because if you think that they have an underlying medical issue, it needs to be treated. And so that would be probably my best advice. It would be
That's powerful advice. And I love your transparency about not being your best self, because I felt the same way for a lot of years. And, it's one of my bigger regrets, because in looking back, my endless chasing, this magic cure that I thought was out there, or this, answer, I was forgetting what was really important all around me. And I think it's because I couldn't accept that there really was no finish line. I really needed to just realize we are going to always, to some degree, hopefully a much better degree, we're always going to be dealing with the repercussions of this to some degree. Now it's not to that big of a degree anymore. It's much, much lighter. I couldn't see that then, and I felt this sense of desperation. But I hope that moms in our age bracket can help the moms in their 20s and their 30s to realize you're okay. You don't have to have the answer today. You don't have to figure it out today. And then what you just said, but follow your gut and be aggressive, and don't be afraid to argue with people. And if you feel like they're wrong or they're dismissing you, argue back. Go get the answer.
I would say, that is your child.
Yep.
You know your child best. We don't let people tell us something about our children. So
Yep.
someone is going to tell us no. We get in the car or we get on a plane and we go to somebody who will say yes. That's what we do for our kids.
Yep.
So nobody's telling me no. That's not how this is going to go. So
I
yeah.
love it. I love it. Well, and it worked. You did it. You did it. And here you stand and look at it.
It comes in pieces, right? And so it's interesting that you said, and because I was kind of touching on this earlier, where people want like that one pill, that one fix, that one, I want this, to help my child achieve everything, be the best that they can be and function as well as they can function. I want this one wham bam, pill.
Thank you, ma'am.
Yeah. So that's not how it happened here. That's not what happened. What happened was we got some really great progress from a couple different things, but it was very long. It's very complex. It's not it's multiple layers that you have to keep peeling back. You can't start all of these treatments at once, even if you end up and your child was affected medically like mine was, and you discover that they have a bowel disease and they have a mitochondrial disease and they have a folate deficiency and they have these issues that need to be treated. You're not starting those things all in one day. That's not how it goes. So you're peeling back the layers. Yeah, a medical doctor should be the one that helps you decide which treatment you're going to start first, second, and third.
Sorry about that abrupt split right there, but we are back. We are back. So we were wrapping things up. I think we were talking about self-care, the importance of following your gut. And you were saying that you had just finished chapter 4 of our hopeful book.
Yeah, I feel like this is probably my right time. So I actually tried to start something about 10 years ago, which it just really wasn't the right time for me. My other kids were younger. We were still kind of in the thick of it with trying to find the correct treatment plan for Olivia. And now I feel like we're on the other side of crisis. I will say this, for my first, I've only been on TikTok for a little bit over a year. And for my first, and that was because Olivia actually asked us to do a TikTok.
Yes, you said.
We have to help her manage that. So like we have to be, a part of it too. And so for the first year on TikTok, I tried not to say the word autism in my house ever so that I wouldn't get on the TikTok side of the algorithm. Because I know that our community is extremely divided on a lot of different things, which is very sad to me because as I said before, we're all walking the walk.
Yeah.
Whether or not we're walking the exact same turn, we're still walking the same walk, and so there's a lot of people that believe A or believe B or believe C, and we already have enough going on. We already have enough stress. We already have enough going on in our day-to-day that I will not spend my time fighting with another special needs parent.
Amen.
For myself, but for them. They don't need it. I don't need it.
No.
Don't need it. And so I tried to stay off of like autism social media for a little bit. And then, of course, somebody said something that pissed me off. And then I did a video that had the word autism, and then it's all downhill from there, And so I did a video and was like, yeah, my daughter has autism, And so since then, I will say this, I feel like there's been a little spark lit in me again. I feel like people helped me. They did. And I would not have been able to do everything that I did with my daughter and get her to where she is today without them.
Right.
And there are people, I'm getting messages, 200 to 500 messages a day right now from other mothers. And like I said, I can feel their desperation, and I can feel mine like it was yesterday.
Yeah.
And they are me and I am them.
Yep.
So I think maybe it's my time to pay it forward.
I agree. And you have a gift for it. You have a gift. Like I said before we got cut off, you're clear. you're intelligent, you're easy to listen to, you're entertaining, and you have an incredible story. And that's why this podcast exists. The same reason. Lisa and I are just watching our DMs fill up after the show. And I was like, I can't get, I literally physically can't answer all these questions. And I didn't know. I didn't have an answer or a thought for a lot of these moms, but I know there's people out there that do. And I'm like, if I've got the capacity to bring these people together to all work for good, and, you know, Nikki Tomczak's answer might not work for this kid, but Nikki Smith's might, and Lee Smith's might work for that mom, and Betsy Russ's might work for that mom.
Yeah.
So we all need to just be helping each other.
I agree. I love it. Yeah.
Yeah, I do too. That's why we're here. That's why I'm talking to you.
Not any single one person knows every single thing. That's just
No.
how we're built. So we have to work together to use each other for what we're good at.
Yes.
So, yeah, I'm thinking this will be maybe my time, you know, where I get to the end. Because one of the things I really struggle with is the people that want me to be able to answer all of these complex questions in a 3-minute video or in a 1-hour podcast.
Yeah.
You just can't. We've been through too much. It's impossible for me to do that. But in a book, I could do it.
You can do it. You can do it.
By chapter, I can do it by category. I can do it to where I can get it into the hands of people in a way that they can understand, coming from a mom's point of view.
Yep.
These are the facts. This is what we did. This is what happened. If it helps you, amazing. And if it doesn't help you, maybe it'll help somebody that you know, because we are 1 in 34.
Yeah. 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 We are. And yeah, I love it. And that is the whole point of this podcast. That's the way we can turn all these hard things into a positive and really be there for each other. And, you know, for so many people, I mean, the medical stuff might really be where a lot of the issues are coming from. It's not for everybody. You know, it's not for everybody. For some people, it has nothing to do with it. But for a lot, it probably does.
Yeah.
And I mean, just think of the good you could do by sharing Olivia's story. It's amazing. I love it.
Well, thank you so much for having me.
Oh my gosh. Well, I am just so honored and thrilled that you took the time. I know that you are so busy. Tell people where they can find you if they want to follow you.
So we are Marty and Nikki on TikTok. And we actually just started up a YouTube because I'm thinking about doing some more in-depth videos about our medical journey on there as well. And we also have the idea of our own podcast possibly rolling out. We were talking about that before I had the heart attack. And then I was like, brakes, hold on a second. Let's see how much I can handle. So we're kind of talking about doing that. So we are trying to get the YouTube page up and running so that we can put more long form content on that platform. So we are Marty and Nikki on both platforms, TikTok and YouTube.
I love it.
I'm not on Instagram because I'm a brat and I don't know how to do it. And I refuse to learn something new. But if I have to get on there someday, I will.
Someday. Yeah. Oh, it's overwhelming. Multiple social media platforms is so overwhelming. But, well, your story is amazing. Your family is amazing. Olivia is beautiful. And it was an honor to talk to you. Thank you so much for coming.
Have me. I appreciate it. We adore your family very much. We obviously love the show. And since my daughter has autism, she's been watching on repeat for 3 months. So
I love it.
She's giving you guys all kinds of views. Now,
yeah, keep on going, Olivia.
Talk about, she's talking about dating now, which Marty doesn't like you for, but
I'm so sorry. Blame Ken. Blame Ken. I love that. That's so funny. Well, Nikki, you are a delight, and thank you so much for joining us. We have a little sign off. We always say thank you for coming and love you mean it.
Okay.
So thank you so much.
Okay, bye.
And everybody go follow. Thank you. All
right,
bye.
Lastly, everybody, if you liked hanging out with us today, do us a favor, hit the follow button, leave a rating, or drop a quick review. It helps more than you know. And if you really loved it, send it to a friend who needs to hear this. And if you're interested in sponsoring a future episode, please send us an email at talktomesismail@gmail.com. Thanks for listening and love you mean.